how important is in long-term use of the X39 for someone who might have some chronic challenges that they're going through that may not feel improvement for the first 2 to 3 months? What is your advice if they're not seeing the improvement right away? And again, they got some chronic challenges and they really want to push through it.
I'm super healthy. I don't have any issues except life, which you can't get around it, right? But I'm just trying to be funny. But anyways, I took 6 weeks to get a testimony, but man, I used everyone and their mother's testimony.
Yeah.
So
tell them a little bit about what you would advise people that might not seeing a quick result, 2 to 3 months, and especially for like people that are chronically challenged.
Yeah. So we've performed over 80 clinical studies now. So what I'm about to say is based on the evidence in these studies that we've collected. And the first thing is that when we're measuring people's blood, when we're measuring urine samples, looking at the metabolism, taking bioelectrical tests, almost everybody responds immediately. But it doesn't mean that people are going to see or feel those changes immediately. But for example, when people wear X39, the copper peptide levels will go up to statistical significance within 24 hours. But that doesn't mean people will necessarily see effects. And when someone has a chronic issue, so let's say that someone is dealing with arthritis. So this is a chronic inflammatory problem. The issue here is that the stem cells, and this was discovered, I met this medical doctor. He was at Sanford Burnham in La Jolla, California. Great guy. And his discovery was that the stem cells in the body are attracted to inflammatory cytokines. So in other words, you get an injury, there's inflammation at the injury site, and the stem cells go in to repair the damage. That's how the stem cells know where to go. They're attracted to the inflammation. The problem, though, is that when someone is in a chronic state of disease, their antioxidant systems have failed and is not able to manage that inflammation. So when the stem cells get to the injury site, the stem cells die. And that's why the injury isn't healing. So we have to look at a systemic, holistic way of managing this. And it's absolutely possible. So the first one, people have to get enough rest. Don't underestimate the amount of rest that you need. Let's say target should be 7 hours per day, 8 hours better, but 7 hours per day. Another thing, people need to consume enough water to reduce the amount of caffeine, not rely so much on coffee, tea. Make sure people are staying hydrated, drink enough water. And the reason is that you need water to make energy and you need water to detoxify. Of course, have a healthy diet and fill in any deficiencies in your diet with supplements. So we have a phenomenal supplement that's coming out, and I've made many recommendations in the past for chronic disease on what supplements people should take to help revitalize their cells. And then, of course, exercise is important. We don't have time to get, kind of into all that. But then when you're going to use a tool like X39, then it's going to be more effective. Another thing that people can do is combine X39 with the Eon patch when they're in a chronic state, because Eon is a broad spectrum anti-inflammatory. So the combination of X39 and Eon helps to better manage inflammation and then elevate copper peptides so stem cells can do what they're supposed to. Some people, this will happen the first few weeks. Other people, it's going to take a little bit longer than that. But, I would say people need to get their foundation in line. They need to be drinking enough water, getting enough sleep, committing to a regular exercise program, eating healthy, supplementing where needed. And then tools like X39 and Eon are going to do an amazing job for them.
Excellent, excellent. So the next question is,